Many people with tracheostomy tubes have reached out to me and asked, which doctor do I see for my tracheostomy tube? Now, I will say this is a little bit of a complicated question because it depends on a couple different variables. For example, do you just have a tracheostomy tube, or do you have a tracheostomy tube which is attached to a ventilator? There are a number of different doctors you can see if you have a tracheostomy tube. So let's run down the different doctors you can see. I will give you some of my experiences with seeing the different doctors, and stay tuned to the end where I will reveal the very best doctor I've ever found to manage my tracheostomy tube. The first doctor I'm going to discuss is called an otolaryngologist. This doctor is often called an ear, nose, and throat doctor, which is frequently abbreviated as ENT. An ear, nose, and throat doctor does exactly what the name says. They are in charge of your ears, your nose, and your throat. With that being said, they can manage your tracheostomy tube. They will sometimes be very knowledgeable about tracheostomy tubes, but sometimes they will not. I have found that ENTs will gladly change out your tracheostomy tube. So if you simply need a doctor to change out your tracheostomy tube because you don't feel comfortable doing this, or you don't have a respiratory therapist who can do this, or you don't have a nurse that can do this, please feel free to see an ENT. The ENT knows how to change out a tracheostomy tube. I will caution you a little bit because some ENTs I have seen are not very knowledgeable about tracheostomy tubes. They know how to change them. They know the basics of a tracheostomy tube, but they do not know a lot about inner cannulas. They don't know about fenestrations. They don't know about cuffed versus uncuffed tracheostomy tubes. They seem to have a lot of knowledge just about generally pulling tracheostomy tubes in and out of the airway, but they don't have a lot of knowledge about the intricacies. Now, your ENT might have a lot of knowledge about your tracheostomy tube, about the different functions and the different features that are available with your tracheostomy tube. I will say, please feel free to continue seeing that medical provider. They might be the perfect provider for you. However, for myself, all the ear, nose, and throat doctors I have seen have not been very resourceful for me. They don't know about the different features on my tracheostomy tube. And as a matter of fact, when I went to see one ear, nose, and throat doctor, he saw I had a cuff on my tracheostomy tube, and he actually told me, come back next time, and next time I'll take out that cuff tracheostomy tube and I'll give you an uncuffed tracheostomy tube because there's no reason you need that cuff on that tracheostomy tube. Now, that was not very good medical advice because the reason I have a cuff on my tracheostomy tube is because I'm attached to a ventilator and I need to inflate the cuff on my tracheostomy tube to give myself full ventilatory support. This is very important because with the cuff deflated on my tracheostomy tube, I have to use some of my respiratory muscles to breathe. I can do this for short periods of time, but my respiratory muscles eventually fail. And then when they fail, I need the full support from the ventilator. Also, at night, I have a condition called central sleep apnea. My body forgets to breathe. And if I don't have the cuff on my tracheostomy tube inflated, the ventilator will give me some breath support in. But unfortunately, if that cuff is deflated, a lot of the air will just go up through my nose and mouth, and this will not provide me adequate ventilation during the night. So it is imperative that I have a cuff on a tracheostomy tube. Unfortunately, this ear, nose, and throat doctor didn't know that and didn't seem to understand why I had a cuff on my tracheostomy tube. And I thought that was very bad advice for the ear, nose, and throat doctor to try to say, yes, you don't need that cuff anymore. Oh, don't worry, it'll be fine. I thought that was bad advice because he should have consulted with my pulmonologist. Now, this brings me to the second doctor, which is called a pulmonologist. The pulmonologist is also called a lung doctor. The pulmonologist is in charge of your lungs and your breathing issues. So if you have a ventilator, you will very likely see a pulmonologist. If you just have a tracheostomy tube, you may or may not see a pulmonologist. Now, this gets a little bit confusing because actually where your tracheostomy tube enters into your trachea technically is under the guidance of the pulmonologist. That is technically the pulmonologist area, but your nose and throat may also be managing your tracheostomy tube if you just have a tracheostomy tube, because the ear, nose, and throat doctor can manage down into that area. It is kind of a gray area, but I'm just going to say if you have a ventilator, the pulmonologist will generally be the person that you will see for your tracheostomy tube. However, if you have a tracheostomy tube and you're also seeing a pulmonologist, don't be afraid to ask the pulmonologist about your tracheostomy tube, because they are usually quite informative about tracheostomy tubes. They do know about cuffed versus uncuffed tracheostomy tubes. And if you're having issues with your tracheostomy tube, they might be able to provide you some guidance that perhaps your ear, nose, and throat doctor can't provide. And now let's digress back and talk about a person that has a tracheostomy tube with a ventilator. The pulmonologist is the person you're going to rely on for your respiratory issues. However, I'm going to tell you, not all pulmonologists are very knowledgeable about tracheostomy tubes. I have had some pulmonologists that know the basics. They know about cuffed versus uncuffed, fenestrated versus unfenestrated tracheostomy tubes, but the different brands, Shiley, Bivona, Traco, they're not very familiar with, and they're not very familiar with if you perhaps need a special tracheostomy tube, perhaps you need a special feature called subglottic suctioning. They're not real familiar with those extra features, and that's where this third doctor can come in. The third doctor is called a critical care medicine doctor. These doctors are the ones that work in the intensive care unit. These doctors are very familiar with tracheostomy tubes. They deal with tracheostomy tubes, I would say, almost on a daily basis, and they are very knowledgeable about if you need a cuffed tracheostomy tube, if you can use an uncuffed tracheostomy tube. Perhaps fenestrations are great for you. Perhaps you don't need fenestration. Perhaps you need subglottic suctioning. Perhaps subglottic suctioning is not so good for you. They really know their tracheostomy tubes. And I will tell you, they have been the most knowledgeable for me with my tracheostomy tube. When I was having issues with my tracheostomy tube after I first got it in 2017, I was having a lot of issues breathing. I went to several different pulmonologists, and none of them seemed to know anything about the tracheostomy tube. They did not know that the tracheostomy tube could be too long and dig into your trachea. So I ended up going to the hospital. I was taken up to the intensive care unit. In the intensive care unit, I saw a critical medicine doctor, and immediately she thought, there's something wrong with my tracheostomy tube. We need to take out the tracheostomy tube. We need to look at your trachea because there's something wrong with the tracheostomy tube. Remember, I saw several different pulmonologists, and they all thought my tracheostomy tube was fine. So the critical care medicine doctors, they're able to very quickly pick up on issues if you have an issue with a tracheostomy tube. And I found that just critical care medicine doctors through the years, since 2017, I've seen multiple different critical care medicine doctors because I've been in the intensive care unit many different times. But I found that they have been phenomenal in getting me the correct tracheostomy tube. I have had different issues, such as I was allergic to the Bivona, I was allergic to the silicone, so I needed a Shiley tracheostomy tube. And the critical care medicine doctors have been the ones that have been really leading that and helping me find the right tracheostomy tube. My pulmonologist, I really love him, and he's great at managing my ventilator. But the critical care medicine doctors are the ones that really have helped resolve all my tracheostomy tube issues. And for that reason, I actually have switched from my pulmonologist, and now I have gotten a pulmonologist that has the specialty of being a critical care medicine doctor. So when you're looking for a pulmonologist, look also that the person is a critical care medicine specialist. If you find that designation, it means that doctor also works in the intensive care unit. And with that being said, they will be very knowledgeable about your tracheostomy tube. They will also be very knowledgeable about your ventilator. I found that having a critical care medicine specialist has really been a game changer for my ventilator, for my tracheostomy tube, and it has really helped me get through these years as I've learned about tracheostomy tubes. One last person I'm going to mention. This person is not a doctor, but they have a lot of knowledge about ventilators and tracheostomy tubes, and that person is a respiratory therapist. Respiratory therapists are very knowledgeable about your ventilator, so please, if you're having any sort of breathing issues, if it's regarding your ventilator, they will be able to sort that out. They will usually be able to do different settings, try to figure out what works for you, what doesn't work for you, and they're able to get that signed off a lot of times by the doctor. They will tell the doctor, hey, this person needs this setting. Can you sign off so we can change the order so we can make this setting permanent? Also, your respiratory therapist is instrumental. If you're having breathing issues with your tracheostomy tube, a lot of times they will have ideas. Perhaps this ventilator tubing is too heavy and it's really pulling on your tracheostomy tube. That does happen. Your respiratory therapist might be able to see your setup in your home and see that and say, oh, you need a device which will help keep this from being so heavy. And there's a little arm that you can attach to your machine and it will help prevent this from dragging on your tracheostomy tube. Your respiratory therapist is really invaluable. They can figure out things for you. So please, if you're having issues with your ventilator, if you're having issues with your tracheostomy tube, please say something to your respiratory therapist. A lot of times they have seen these issues before, or they've had so many patients in the past that have had these issues and they will keep tabs. For example, if you're having an issue with the tracheostomy tube and you go to the doctor, please tell your respiratory therapist about this because they can catalog it in their brain. And then the next time they see somebody that has a similar issue, they can go, oh, I remember this patient that had this, and they can say, oh, they did this or they did this. So ask your respiratory therapist because a lot of times they have this catalog in their brain and they can go, oh yeah, I remember a patient that had that issue. This is what helped, or they tried this. This did not help. They needed this. So please, please, please make a use and make a resource out of your respiratory therapist. They're instrumental in helping you breathe. They're instrumental with your tracheostomy tube. Also, some respiratory therapists will also change out tracheostomy tubes. I will say some because some respiratory therapists do not feel comfortable changing out a tracheostomy tube. So if you have questions about how to change out a tracheostomy tube, please ask your respiratory therapist. They may or may not, depending on your respiratory therapist, actually walk you through on how to do a tracheostomy tube exchange. They may not and may require you go into the doctor's office. But with all that said, so you have an ear, nose, and throat doctor, again, knows how to change a tracheostomy tube, knows a little bit about tracheostomy tubes, but in general, I found they don't know a lot about tracheostomy tubes, which, depending on your situation, could be okay for you or it could not be so good for you. The next person is we have a pulmonologist. Pulmonologist knows quite a bit about ventilators. They know a little bit more about tracheostomy tubes, such as cuffed versus uncuffed tracheostomy tubes. But again, they're still limited because they probably don't deal with tracheostomy tubes on a large scale basis unless the doctor really specializes with tracheostomy tubes and or ventilators. But the doctor that I really would suggest, if you have a tracheostomy tube and ventilator, or even just a tracheostomy tube and you're having a lot of issues with your tracheostomy tube, I would suggest please go see a critical care medicine doctor. This specialist is very knowledgeable about tracheostomy tubes and ventilators, and I feel like you get the best of all worlds with seeing a critical medicine doctor. And they have provided the best support for me for my tracheostomy tube and for my ventilator. And also, do not be shy to talk to respiratory therapists, whether their respiratory therapist comes into your home or if you happen to be at the hospital. Please ask questions and make the best use of your respiratory therapist because they are a wealth of information. And I feel like many times people don't ask them questions. People don't make the most out of the respiratory therapist, and the respiratory therapist can really provide a lot of guidance and insight to your tracheostomy tube. And if you have a ventilator, also for your ventilator. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.